Hello, everyone. Welcome to Wellbeing Conversations. My name is Maria Thackeray, Well Team Lead, and this training is for line managers, leaders of peoples, and colleagues. So, what is a wellbeing conversation? Well, it sounds simple enough, but actually, we might have some staff that struggle with this aspect because asking the question, "How are you?" might seem quite daunting to some people. So, health and wellbeing conversations are intended to be those regular, supportive, coaching style one-to-one conversations focused on looking after the well-being of our diverse NHS workforce. They should be thinking about that person as a whole and a holistic approach, which could be physical, mental, emotional, to name a few, and identify areas where the individual may need support, signpost them to that support, and regularly monitor their well-being over time. So we're having these conversations regularly. By encouraging organisations to embed wellbeing conversations across their system, we aim to create cultures where people feel heard, valued, and in which diversity is respected. These should be, in turn, and encourage us all to pass care and compassion to each other, to patients and to our families. Therefore, happy staff means happy patients. Who should hold the conversation? In most cases, a health and wellbeing conversation will be held by that line manager or supervisor within the team. However, you do find that in some instances within a team, there is always a couple of colleagues who will naturally gravitate towards asking people how they're feeling and how they can be helped. So they might feel more comfortable talking to another trusted colleague about their well-being. Our top tip: whilst the main intention is for line managers to hold a wellbeing conversation with their colleagues, we would encourage everyone within that team to support one another by regularly checking in with that person. When should I approach a wellbeing conversation? Well, actually, it's in our best interest to check in with our staff regularly and make sure that that person is as healthy and as happy as they can be at work. So health and wellbeing conversations should be regularly discussed in teams and line management relationships in order for us to change the culture of our workforce. Health and wellbeing conversations can be incorporated into existing conversations or may be implemented as a standalone discussion. Some examples could include regular one-to-ones and staff check-ins, standalone wellbeing conversations, those water cooler moments, and team meetings or shift handovers are a really good time to check the feeling in the room and how people are doing. How should I approach a wellbeing conversation? Firstly, check in with yourself first and make sure that you feel happy and comfortable to do so. Whether it's taking place in person, virtually, hold a wellbeing conversation in a confidential and a safe space if you can. A great way to just start the conversation is by asking, "How are you?" and really listen to that person. Actively listening can make that colleague feel valued and listened to. Can you remember a time that you were listened to, where someone really listened to your values and needs, and how you felt when you came away from that conversation? Follow it up with further questions and allow your colleagues to share those further details that they are comfortable with. So, what does good practice look like for wellbeing conversations? Wellbeing conversations are caring and compassionate. They give space to enable the employees to holistically explore their own well-being. Employee-led. It's always really important to enable the employee to lead the conversation and focus on the most important things to them. Supportive. They signpost employees to the most appropriate support. Ongoing and dynamic. Well-being changes over time. Therefore, these conversations should be held regularly. Inclusive. Every NHS employee should have ongoing supportive conversations that enable their unique and diverse personal well-being needs to be met. It's also important that we think about what well-being conversations are not. They are not therapeutic interventions. Employees should, where necessary, be signposted to access appropriate support from trained professionals. You're not expected to be a counsellor, just be that middle person to signpost staff. Judgmental or performance related. Wellbeing conversations should not be used for performance management or as a way of judging the quality of someone's work. A formal risk assessment. All NHS colleagues should be invited to complete a risk assessment at their place of work. A wellbeing conversation does not replace this requirement. It's also important to note that a wellbeing conversation should sit separately from an appraisal, and this should remain the case. To help get you started and feeling happy and confident to have a wellbeing conversation with your colleagues and staff members, the Well team have created a wellbeing conversation template for you to follow should you feel like you need it. As you can see, the stick person certainly has a lot going on and that they bring into work with them on a daily basis. Over time, this will have an effect on that person, and that's why it's so important to have these conversations with our staff regularly. It could be that that person is bringing in financial difficulties, their lifestyle might have changed, their physical health has become affected, their lack of sleep or sleeping more, exercise or injury, their home life and caring responsibilities have become affected, relationships might have broken down, their own learning and personal growth within work, their personal safety has been compromised, and the mental health, emotional, and psychological stress that that person might face on a daily basis might be hard for them to come into work. Retention is a really important thing within the NHS, and keeping our staff healthy and well should be our priority. This conversation template can be used for you to follow if you feel like you need to. When you're ready, have a look at this short, powerful video from NHS England explaining why wellbeing conversations are so important to have in the workplace and the positive impact they can have on patient care. Once you've done this training, please have a look at other areas you can access support for your team members and colleagues. Have a look at our Staff Health and Wellbeing website, which focuses on further information and support on all things health and wellbeing. In our website sits our wellbeing directory, our monthly newsletter and calendar, any training like our wellbeing conversations, or workforce wellbeing and trauma support training for line managers, and how to become a wellbeing and engagement champion. Wellbeing and engagement champions. So the NHS People Plan outlines the ambition to enable NHS organisations to create that culture of wellbeing through the workforce. So by enabling wellbeing conversations and with the introduction of wellbeing and engagement champions, we're heading towards the right direction to make the workplace a healthier and happier environment to be in. We're constantly looking to recruit colleagues from across the Trust to join our growing community of wellbeing and engagement champions. The role is designed to support the health and well-being of you and your colleagues and to contribute to those healthy working environments that we all strive to be in. This is a voluntary role for anyone with a clinical or non-clinical background in any role at any band. Our team will offer a wide range of resources to ensure that you are able to offer the team the support that they need. We send regular emails to champions so that they're first in the know. Our monthly drop-in sessions via Teams hosted by our champion leads. On this monthly drop-in session, we focus on healthy lifestyle changes such as exercise, sleep, smoking support, and it gives the champions time to network with one another and get ideas for their areas and teams so they can be the first in the know. For more information, visit our area of the website dedicated to the Wellbeing and Engagement Champions.